guys, so we are going, my group consisting of Ahmed Hamad, Aline Haddad, and Mahdi Mansour, and I, Karen. So, clinical scenario 2 is a 30-year-old woman who has recently given birth, coming to my clinic. She is concerned about the risk of postpartum depression and wonders if there is a link between breastfeeding and a reduced risk of developing postpartum depression. She wants to know if breastfeeding can help lower her chances of experiencing postpartum depression. So in this case, we are looking at PECO, which is the population is the postpartum women. The exposure is the breastfeeding. The comparison is no breastfeeding, and the outcome is reduction in risk of developing postpartum depression. This is a prognosis question, and the best study design to address our study question is a cohort design. So we need to note here that the comparison is no breastfeeding. It might include no breastfeeding at all, or it might include other types of feeding, such as formula. So we go to PubMed.
So now we'll go to PubMed, then we go to the MeSH database to search for breastfeeding. So if you look at the definition of that, it's nursing of an infant at the breast. This includes, if we look at the entry terms and the trees, we can all see that they are all related and included in the breastfeeding. So we can add it to the search builder and copy it as MeSH. Then we have to look for it as a keyword. So that includes breastfeed with a space as text word, or breastfeed without space, or breastfeed with a hyphen with o-ring between them all, and of course between quotations. And then we can or both the MeSH and the keyword. And with truncations, of course. I think this is good enough. I think now we can go back and start looking for the MeSH of the outcome, which is postpartum depression.
Yes, we start by the depression postpartum, searching for the MeSH, for the adequate MeSH. Postpartum depression. It is defined as a usually within 4 weeks after giving birth, and the degree of depression ranges from mild to transient depression to psychotic disorders. Okay, so we can take that as a MeSH and add to the MeSH builder. It includes postpartum depression, postnatal depression, postnatal, and all the other related searches.
They seem relevant.
So just to keep in mind, sorry to interrupt, just to keep in mind that there are nothing under the postpartum depression, so we do not need to explode it.
Yes, I agree.
So keep it as such.
Okay.
And then we have to search postpartum depression as a keyword search. So we put postpartum depression in quotations without a space between them, and then we can put or the postpartum depression with space and postpartum depression with a dash between post and partum, and we have to order them all together.
And these include truncation and proximity method in PubMed. In the title and the abstract and the text words. Okay, so we search.
And this might take a bit of time to be inclusive of all the studies.
We go to advanced, and we or concept number 4 and concept number 5. We go to advanced again to make sure that our search is right. We add the concept number 6 and the concept number 3, which are the breastfeeding as a keyword and as a mesh, or together, and ended with the concept of postpartum depression as a mesh or as a keyword search.
Okay, so
now
that
the number of results we got
is 1085, which is a bit too much, so we're gonna need to limit.
Yes.
So first we go to advanced and we check the details and we copy all of our search.
Yes.
And then we go back to PubMed and we go to clinical queries, where we can paste our search and go to prognosis, and then we'll go to now.
Keep it as broad for now.
Let's see how many studies we get.
And we search. We have 225, which is still a bit too high.
Let's see if we narrow it.
Let's try to
We can afford to narrow, yeah. So we go for narrow, and we have 147, which is a decent number. So out of those,
let's look at some of those and see all results and PubMed. Yeah.
out of those, study.
Oh, no, we've looked through them before.
Yes.
When we were conceptualizing the study.
So study number 11 was found to fit our question best.
I think so as well.
Okay.
Yes, I agree.
Thank you.
Thank you.
Thank you.
Thank you.